The first jump we're going to have Katie here do is what's called a wall or a block jump. She's going to turn here. We want to be about shoulder width away from the wall. Once again, we're emphasizing all the joint mechanics that we've been stressing throughout the protocol. She's going to start with her knees flexed, hands on the knees, and then she's going to jump up, touch the wall, land in that soft position, watching her joint alignment. She's landing toe to heel, absorbing the energy with her ankles, her knees, and her hips. We're going to do this for 20 seconds to begin with. Throughout the protocol, the time is going to change. And she's keeping great form. She's decreasing that amortization phase. This first 2-week phase of the jump program, we want to really focus on mechanics. Form, form, form. Okay, good. And that is a wall or a block jump. The next jump we're going to do is a broad jump. It's much like what we do in the functional testing, except we're going to turn this into an exercise. So I'm going to have her get into her squat position, shoulder width apart, and she's going to jump forward, landing heel to toe. That activates the hamstrings first, and she's going to stick and hold in that low flexion angle, which really incorporates co-contraction of both the quads and the hamstring. We're going to repeat this usually 5 reps, and we'll increase that amount as the protocol progresses. And that is the broad jump. The next plyometric we're going to do is called a squat jump. For this jump, we're going to have the athlete get shoulder width apart. She's going to reach down and touch the turf, keeping that good alignment, and jump up, reaching for the ceiling, landing with good alignment. So she's landing in that knee flex position, toe to heel landing. Once again, we're looking for flexion angles greater than 60 degrees. That's the beauty of this jump. It really engages the hamstrings. And that is the squat jump. You're going to repeat that for the desired time, and it will progress throughout the phases. This next plyometric is called the 180-degree or half spin jump. What we're going to have our athlete do is get into the squat position, that start and finish position. She's going to jump vertical, turn in midair, and land in that same position and repeat. We want to make sure we have our athletes jump, then turn, not turn while they're jumping. It's a dangerous predicament for the knee to be in. She's going to repeat this for the given time. This is a great exercise. It's working multiple planes and really stresses the balance. That is the 180 or half spin jump. One of the most important exercises throughout the protocol, and it is repeated throughout the protocol with different variations, is what we call lateral bounding in place. What we're going to have Katie do is get into that good athletic position, butt back, a little wider on the feet. And what we're going to have her do is almost like a weight shift. She's going to land in this flex knee position, shifting her weight from right to left. This is the first body weight exercise we do in the coronal plane. It's similar to cutting, and as we progress throughout the program, we're going to get more aggressive and add a few tweaks to this exercise. So what she's going to do, she's going to shift her weight to the right, load and unload, load and unload. So at first, we want her just getting confidence in that leg and that surgical knee. And as she progresses, we're going to have her go quicker, decreasing the amortization phase or when her foot's on the ground. And obviously work more for more explosion and power. Early on though, we just want to go nice and slow with this, making sure they keep good sound joint mechanics like she's doing. And the 20 to 30 second bout is usually what we start with. So this is lateral bounding in place. This next jump is called the scissor or rudder jump. This is one of the more difficult jumps in the first phase. For this jump, we're going to ask the patient to get into a split leg squat position. She's going to jump up, switch her legs. The object of this jump is keeping the chest over the knee. The front leg should hit the ground before the back leg, and we want to try to keep the back leg as straight as possible. This really overloads that front leg. You're getting maximal co-contraction of the quadricep and hamstring during this exercise. As she progresses, we ask her to get more height with each jump. And that is the split leg squat or rudder jump. The next jump we're going to do is called ricochets. There's 2 types of ricochets. We're going to do front to back and side to side. With ricochets front to back, we're going to have her get in the ready position. She's going to jump over a barrier here and then back, landing toe to heel. So it's heel to toe on the front, toe to heel on the back. Soft landings. We're looking for about 18 inches or about shoulder width as far as how much excursion between the feet here. We usually don't start with the barriers, and we kind of add that in as the patient progresses. So this is Ricochet's bilateral front to back. For the next one, we're going to have her turn sideways, and we're going to do the same exercise, jumping side to side. We also call these mogul jumps. So she's going to get in the ready position. She's going to jump up and over, toe to heel, loading and unloading that knee. So once again, we're trying to decrease the amortization phase, or when the feet are on the ground, using that eccentric muscle strength to rebound and come right back into the next jump. And that is Ricochet's bilateral side to side.